Hey everybody, it's Dr. Eric Balkowitz. We're back for another edition of Thyroid Thursday, and today we're staying kind of on this theme for the week. And we're talking about, does the cell danger response apply to all cases of hypothyroidism? And the answer is no, it does not. But it probably applies to a lot of cases of hypothyroidism. So let's take a deeper dive. So what is the cell danger response? This is a innate, adaptive, protective response when cells and your tissues, your body senses danger. And that's usually identified by something called your mitochondria that really senses the shift or the change in cellular physiology. That sense of danger triggers an upregulation of the immune inflammatory response, upregulation of the immune system. It results in a downregulation of homeostatic physiology and instead ramps up defense mechanisms. And part of the significance here is that the reduced conversion of T4 to T3 is part of that cell danger response. And it's my belief that that same cell danger, cell stress response oftentimes actually triggers the thyroiditis, either as a defensive mechanism or secondary to the immune inflammatory process that's going on. So let's dive into what causes hypothyroidism. So the primary causes of hypothyroidism, when we think about this, so just talk big picture, what are the primary causes? Thyroidectomy and radiographic iodine, or radioactive iodine to destroy the gland. And people who have thyroid cancer, people who have Graves' disease, they have their thyroid gland destroyed, irradiated, or both, and then that can result in hypothyroidism. And you could say, okay, well, that's not an immune-driven process. Well, maybe it is, maybe it isn't. What drove the Graves' disease? Graves' disease is an immune-driven process. What if they had cancer? Cancer, maybe, but that is, it's also tied into potentially what's happening with the immune system. You have cells that are supposed to be pruning all these poorly developing or improperly developing cells. They're called your natural killer cells. They should be preventing abnormal cell growth. So again, there may be an immune process going on here. So that's some, but anytime we have Graves' disease specifically, we have to ask what triggered the immune inflammatory response. So the cell danger response could be part here. The other issue is you could have iodine deficiency, especially in areas where we're iodine replete, and we can get a whole conversation about that, what that means. But it seems like iodine deficiency is less of the issue. When you look at the scientific literature, especially in areas that they show have been iodine replete, thyroiditis, immune-driven damage of the gland, is thought to be driving 90–95% of the hypothyroid cases. So then we can ask the question, what's causing thyroiditis, this inflammatory damage to the gland? And when we think about it, a lot of people think it's antibodies that are creating the damage. The antibodies really don't create much of the damage. What's creating much of the damage is the infiltrating lymphocytes. And yes, if you test antibodies can kind of confirm that there might be immune-driven damage, but it's not a very good marker because there are people that have positive thyroid antibodies and don't have thyroiditis going on. There are people that have no antibodies and have significant thyroiditis going on. So it's really what's happening inside the gland, and probably the best way to identify does somebody have thyroiditis is to be doing biopsies and or ultrasounds to see what's happening within the gland. But many times when we see antibodies present, and we see that the person's not producing thyroid hormone, we say they've got Hashimoto's, and if they don't have antibodies, they don't have Hashimoto's. The reality is they have thyroiditis. This is an immune-driven process, and there's how do we address it, at least in my world, is the same. What's triggering immune activation and potentially the cell danger response? So when we break down what the literature shows is causing thyroiditis, 70% of the thyroiditis in the literature says it's immune driven or immune mediated. So this includes Hashimoto's, seronegative thyroiditis, which means they have thyroiditis just like Hashimoto's, but they don't have antibodies, and so they would call it seronegative Hashimoto's. And then silent thyroiditis. So that's 70%. the literature says about 10% of the cases are caused by post-viral infections, and they call these subacute. Well, if you have a virus, viruses are going to trigger a cell danger response. So we've got 70%. This looks like we've got another 10%. So we're now at 80% of the times the cell danger response might be involved. And the only big difference between this one and these is this is thought to be acute, short term. Person may become a little hypo, and then they may resolve on their own. These are thought to continually progress. I would tell you the only difference between these two things is in this situation, the immune system when you fit into the 70% of the people who are continuing to decline, the immune system hasn't identified or addressed the triggers appropriately, so the immune process keeps going. In this situation, there was a viral infection. It activated the cell danger response and the immune response, and then the immune system got that virus under control, and this remissed on its own. 6% are thought to be caused by it's called what they call postpartum thyroiditis, meaning that as mom is coming out of pregnancy and she's done having her baby, during the pregnancy, the immune system is tamped down. It's kind of calmed down so the immune system doesn't damage this developing child inside you. But once the pregnancy is over, then the immune system turns back on again. And there's a bunch of different theories as to why people, after having a baby, have more thyroiditis. Some people say there's material from the baby that got into mom's circulation that's triggering the thyroiditis. Some people just say it's the immune system trying to recalibrate itself because it's been suppressed and now it's turning back on post-pregnancy. It's my thought process that a lot of times, because the immune system is turned down in pregnancy, a lot of women may get infections that they aren't even really aware that are maybe active. Viruses, other organisms that may start to create problems, dysbiosis in their bowel that triggers thyroiditis. But because the immune system is calmed down during pregnancy, they don't realize it. But now, once they're coming out of pregnancy, the immune system is turning back on and saying, hey, we got some bacteria here that we have to defend against. We have some virus here that we have to defend against. We have some other massive stressor going on that we need to defend against. So this could be another case where the cell danger response is involved. Number 5 is iatrogenic causes of thyroiditis, and that's medications. So medications and toxins can trigger a cell danger response, and if medications and toxins create damage to the tissue, that damaged tissue can trigger the cell danger response. So here's another mechanism by which the cell danger response may be involved in triggering thyroiditis. Now, 3% of the cases are thought to be caused by radiation, just from the environment, from procedures. This is not necessarily radiation of the thyroid gland itself, which we talked about up here, but just radiation. Or trauma, somehow the tissue gets damaged or injured. Well, guess what? If you have damaged tissue, that's releasing what we call DAMPs or PAMPs. And those DAMPs can trigger, guess what? The cell stress, cell danger response, the inflammatory response, and the immune response. Same with radiation. And then the last 6%, 4% unknown causes of thyroiditis, 2% some really rare conditions that could cause it. So here I make the case that almost 94% of the cases of thyroiditis probably involve the activation of the cell danger response as part of the potential cause of thyroiditis. It's going based on the literature. So, does the cell danger apply to all cases? No. Could it apply to a lot of cases? Absolutely yes. How do we know if there's a cell danger response in play? For whatever reason, you get diagnosed with hypothyroidism, whatever reason, you get thyroid hormone replacement therapy. You take the medication, your labs return to normal, you have great conversion, all the labs are within the lab reference range, you feel good, you function good, you maintain your body weight, there's no constipation, no signs, no symptoms of hypothyroidism, you probably don't have a current cell danger response. If you get diagnosed for whatever reason, you get put on medication and you can't find a dose that makes you feel normal, healthy, and you still have chronic signs and symptoms of hypothyroidism, and you've tried all the different kinds of medication and nothing seems to restore your health and well-being, there's probably a active cell danger response going on, and your thyroid physiology isn't broken, it's adapting to that consistent threat. Any questions, put them below the video. If you doubt what I'm saying, you can put those doubts below the video, and maybe we'll turn one of your questions or one of your comments into an episode of Thyroid Answers Podcast, Thyroid Answers Shorts, or Thyroid Thursday. Take care.